The heart is regulated for adjustment of the body to physical and emotional needs, and the mechanisms of the regulation of the cardiac activity are divided into the several types. We may distinguish hemodynamic. This regulation is performed by the properties of the blood pressure and the volume of blood that is filling the heart. Second type is nervous. And at last, humoral, by hormones and electrolytes and different humoral factors. So we start with hemodynamic regulation of the cardiac activity. This hemodynamic regulation may be based upon the law of the heart, or Starling's law of the heart. This Starling law of the heart states that the more is filling of the heart with the blood, the stronger is the contraction. We should mention also two consequences of that law. The first one concerning the increase of the post-load. It means the increase of the arterial blood pressure, the blood pressure in arteries, so after the heart. And this consequence states that if the post-load increases, then the strength of contraction increases. Meanwhile, the stroke volume and cardiac output may not change. So if post-load increases and the pressure in venous part, it is called preload, doesn't change, then the strength increases of contraction and the cardiac output and the stroke volume not change. Do not change. The second consequence of that law, if the preload increases, it means the pressure in venous part of the cardiac system, of the cardiovascular system. Venous blood pressure increases and arterial blood pressure doesn't change. In that case, the strength of contractions increases, stroke volume and cardiac output also increase. Okay, then nervous mechanisms. Nervous regulation is performed by intracardial and extracardial mechanisms. Intracardial regulation is fulfilled by intracardial reflexes produced by the metasympathetic nervous system, by local reflex arches. And extracardial is performed by sympathetic and the parasympathetic nervous system. So intracardial nervous regulation, as we told already, is performed by the local reflex arches. For example, there is a receptor, and inside the heart we have the afferent neuron, interconnecting neuron, and the efferent neuron. And if the receptor is stimulated sufficiently, then acetylcholine may be produced in that reflex arch, inhibiting, because acetylcholine inhibits the cardiac activity, and in that case the hyperstimulation of the cardiac receptors will inhibit the cardiac activity, limiting the Starling's law of the heart. These local reflex arches are also may be controlled by the inputs from the sympathetic and parasympathetic nervous system. So this neuron that releases acetylcholine may also receive the impulses from vagus, parasympathetic nerve. Now we will focus on the extracardial sympathetic and parasympathetic regulation of the heart. Sympathetic nervous system innervates. Sympathetic nervous system releases norepinephrine that binds beta 1 receptors. So sympathetic beta 1 adrenoreceptors located in the heart. It increases cyclic AMP concentration, second messenger, and the high permeability for calcium, and slow diastolic depolarization is accelerated. So therefore sympathetic nervous system produces positive effects upon the heart. These positive effects are positive inotropic. It means the increase of the strength of contractions. Positive chronotropic. Increases the frequency of contractions. Positive batmotropic. Increases the excitability of the heart. Positive dromotropic. Dromotropic increases conductivity in the heart, conduction of excitation. And positive tonotropic, it increases the tone of the myocardium. Parasympathetic nervous system, it releases, so it is produced by the vagus nerve, left and right vaguses. Right vagus innervates predominantly sinoatrial node, and left vagus predominantly AV node, atrioventricle node. Acetylcholine is released by the vagus upon the heart, and it increases the permeability of pacemaker cells for potassium. Therefore, the atypical cardiomyocytes are hyperpolarized. So it was slow diastolic depolarization, and the potential was minus 60. It became less, for example, minus 70. And what happens? More time is needed to reach the firing level. Therefore, the parasympathetic nervous system produces negative effects upon the heart. Negative inotropic effect, negative chronotropic, negative batmotropic effect, and negative dromotropic effect. So 4 negative effects upon the heart. So parasympathetic nervous system is inhibiting the cardiac activity. Reflexes of the heart. The reflexes of the heart may be divided into the stimulating and inhibiting reflexes. The first stimulating reflex is Bainbridge reflex, which is produced by the sympathetic nervous system, because sympathetic nervous system stimulates the cardiac activity. This reflex is induced by the stimulation of the receptors in the sinus of the heart, the area in the right atrium where vena cava inferior and vena cava superior are attached to the heart. When this area is expanded by the increased income of the blood, then the receptors in that area, mechanoreceptors, are stimulated, and they are conducted by the vagus to the brain, that is brain stem and spinal cord, and from that area the signal is conducted to the center of the sympathetic nervous system, and through the sympathetic nervous system, through sympathetic ganglions, the nerve fibers, sympathetic nerve fibers, they conduct impulses to stimulate, to increase the cardiac activity. So the increased cardiac activity in this Bainbridge reflex, they compensate the extension of the right atrium, and the volume of the right atrium normalizes. So that is Bainbridge stimulating reflex of the heart. Inhibiting reflex, we will mention baroreceptor reflex of the heart. In that case, so baroreceptors are the nerve endings that are sensitive to the high blood pressure, and they are located, for example, in the aortic arch. Okay, again, draw the heart. This is aorta, and here we see baroreceptors. This will be the baroreceptors, and when the pressure in aorta increases, baroreceptors, they increase the frequency of action potentials. So the blood pressure increases. Blood pressure increases, and the spikes produced with high frequency by these baroreceptors, and these impulses are directed to the center of the brain, where the nucleus of vagus is located, and from this part of the brain the nerve impulses are conducted by the vagus nerve to the sinoatrial pacemaker cardiomyocytes, and this influence will inhibit the cardiac activity. It's a reasonable thing, because the decrease of the cardiac activity will decrease the blood pressure and will normalize the blood pressure in the case when the blood pressure is excessive. The similar reflex is called carotid sinus reflex. carotid sinus is the area of bifurcation of division of the common carotid artery into the internal and external carotid artery, and it is another area of the body where the density of baroreceptors is extremely high, and when the blood pressure increases, the carotid sinus that is innervated by the sensitive afferent nerves will also stimulate the increase of the parasympathetic tone and the decrease of the cardiac activity. Another cardio-inhibiting reflex is called oculocardiac reflex or Aschner-Danini reflex. When the soft pressure is applied on eyeballs, for example by fingers, the vagus tone increases and is inhibiting the cardiac activity. Oculocardiac reflex. Another reflex is called solar reflex, solar plexus stimulation by the pressure on the stomach by a fist, for example, will also inhibit the cardiac activity, will inhibit the frequency of the heartbeats. Geron reflex or Herring-Breuer reflex is the decrease of the cardiac activity during the deep inspiration. So the respiration frequency and depth influences the cardiac activity, and there is so-called respiratory arrhythmia. It means that the respiration slightly changes the frequency of the cardiac activity. It is a normal thing, is a sign of good health and not of the disease. And at last we will speak about the humoral regulation of the heart. Humoral, the third type of the cardiac regulation. Not only hormones but also different electrolytes may change the cardiac activity. For example, calcium ions. Calcium will increase the strength and the frequency of the cardiac activity. Excessive amount of calcium may even stop the cardiac activity, and the heart will remain in the systole, in the state of contraction. Vice versa, potassium decreases the activity of the heart, and excessive amount of potassium in experiment may even stop the heart during diastole. It is used in the clinic for the patients with hypertension. The dried apricots, for example, are prescribed because they contain high amount of potassium. Hormones also should be mentioned. For example, adrenaline or epinephrine, it increases the cardiac activity. It binds beta-1 adrenoreceptors, and the effects are similar to the sympathetic nervous system. The injection of epinephrine directly into the heart is used for in ambulance for resuscitation during clinical death, because it may stimulate the cardiac activity when the heart stops. T3 and T4, the hormones of the thyroid gland, they stimulate the cardiac activity, they increase the heart rate. because they increase the sensitivity of the heart to adrenaline, to epinephrine. The same mechanism may be found in glucocorticoids. Cortisol, for example, also increases the cardiac activity. Glucagon angiotensin 2 peptide, it's a hormone that also stimulates the cardiac activity. Serotonin and other transmitters, hormones, and different factors may change